as a critical care nurse before completing a Bachelor of Arts with honours and a PhD at the University of Melbourne. She is a public health researcher who became interested in aged care when her parents moved to an aged care home. And I think this next story is astounding. After her father died, she stopped full-time work so she could spend as much time with her mum as possible. She wanted her mum's quality of life to be as good as it could be. She wanted her mum to feel valued and be engaged in her twilight years. The time Sarah spent with her mum in the aged care home was precious for them both. Although Sarah enjoyed the 4 years she spent with residents and staff, she watched the comings and goings in the aged care home with a critical eye. She's been a principal researcher at Research Matters since 1999. Her work has focused on public health, mental health, ethics and aged care. She began Aged Care Matters in 2016 and she's published 75 opinion pieces and numerous letters to the Age. And I imagine that's probably out of date by now because I read it on the website and it's a very ongoing process. So just to remember questions at the end, and we'll hand over to Sarah. Thank you, Sarah.
Oh, thank you, Erica, and thank you for the invitation to speak today. I also pay my respects to the Boonwurrung people of the Kulin Nation, their elders past, present and future. I extend my respect to all Aboriginal and Torres Strait people here on Zoom today. The resilience and wisdom of your culture is our nation's greatest treasure. I wish to acknowledge the respect your culture bestows on your elders. I also wish to acknowledge that sovereignty has never been ceded. It always was and always will be Aboriginal land. Sorry, I've got a bit of a croak. The aged care sector is in crisis. Evidence for this statement is in the 8 volumes of the final report of the Royal Commission. Sorry, am I clear? Sorry? I can hear someone talking. Are you able to hear me?
I can't see your face.
Oh, you can't see my face, and that's because I'm actually, unfortunately, and one of the reasons I asked for no questions is I'm actually reading something. Does that mean you can't see me?
I can see your face though, Sarah. So
okay.
Marilyn, you should be able to.
I was told I had 40 minutes to speak, and I can talk about aged care underwater. So I thought I'd better write something so I could time it to be 40 minutes only. So that's why I'm reading. So I hope that's okay. I'm much more familiar in giving talks in your presence. I'm not very, Zoom's not my favourite medium. But anyway, I'll keep battling on because I've just made a big statement. I've said the aged care sector is in crisis. And there's so much evidence to support that statement. We've had 20 plus inquiries that preceded the Royal Commission. So it's a fair statement to make.
Recording in progress.
Okay, something's happened. Okay. Now, a year before the Royal Commission started, I just want to check, is everyone okay and hears me and sees me, or is there problems?
That's excellent.
Okay, good. So a year before the Royal Commission started, the federal government announced yet another aged care inquiry. And soon after this announcement, I bumped into the good old Greg Hunt, who was jogging on the Mount Martha boardwalk. I stopped him. I don't normally stop him, but I did on this occasion. And I asked, why do we need yet another inquiry? Surely the government was aware of the systemic problems in the aged care sector. I told him, and I'm very direct, I told him I thought our aged care system was a national disgrace. Greg disagreed, claiming Australia had a world-class aged care system. The Royal Commission, which was announced a year later, certainly proved me right and Minister Hunt wrong. This morning I will describe what's wrong with the aged care system, but I don't want to focus on what's wrong. I'd prefer to focus on solutions about how to fix the aged care system. The first step, and the most important step, is to shift our ageist attitudes. It was never part of my life plan to be an aged care advocate. I stumbled into aged care advocacy after my parents moved into an aged care home. And with my background as a public health researcher and a registered nurse, as Erica mentioned, I saw the systemic issues in aged care and I began publishing my analysis of these issues in the media. I soon developed a reputation as an independent and informed aged care advocate. It was also not my life plan to stand as the Voices endorsed independent candidate for Flinders. However, when the Voices candidate pulled out and members of Voices voted to endorse a candidate, I put my hand up to replace the aged care minister in his seat of Flinders. By that stage, Greg Hunt was also the aged care minister. Now, I did this primarily to help Voices, but I was also motivated by the failure of successive governments, not just the Liberal governments, lots of governments over the last 20 years, to respond meaningfully to the crisis in aged care. My parents actually enjoyed living in the aged care home. Most staff treated them with kindness, respect and love. Staff in aged care homes are often really hard-working, dedicated people, also in home care, but they're doing a really difficult job for not much pay or professional kudos. Now, my parents chose the aged care home primarily because they could sleep together in the same room. In fact, it was the only home we could find where they could sleep together. It's important to stress that they chose the aged care home themselves. Unlike many families who are forced to make the decision quickly after an older person has a health crisis, they might have a fall or a heart attack, my parents moved into the aged care home when they were both in reasonably good health. I noted with interest during the Royal Commission that Merle Mitchell, who some of you may remember was the president of the Australian Council of Social Service, ACOS, and she was a resident in an aged care home, and she gave a testimony to the Royal Commission where she said her aged care home was not a home. In contrast, Mum and Dad called Victoria by the Park their home. This suggests there are huge variations in aged care homes, ranging from the dangerously bad, like the ones we hear about in the media, to the very good that we hear very little about in the media. My parents were lucky to choose a good aged care home. However, choosing a good aged care home should not rely on luck. So after Dad's death, and Eric has mentioned this, I began visiting Mum. I had a little routine where I would arrive each day around lunchtime and I would sit at the dining table with Mum's friends. Mum, as a 90-year-old, didn't have very large appetite, so she was always given a full portion at lunchtime so that I could eat her leftovers. And the food was really excellent, certainly much better than I cook. In the afternoon, when Mum's great-grandchildren visited, we transformed the lounge room into romper room, which Mum and the other residents really enjoyed. We had our own old people's home for 4-year-olds. A year or so after visiting Mum, I became concerned that the media only reported horror stories about aged care. Surely Mum was not living in the only good aged care home in Australia. So as a researcher, I designed an open-ended questionnaire for family and friends, asking them to describe their experiences of the aged care home. 174 people from around Australia completed the questionnaire. However, and for me disappointingly, they mostly described their negative experiences, some that were quite shocking, similar to what we heard during the Royal Commission. I sent my report to Ken Wyatt, who at the time was the Minister for Aged Care. I encouraged him and his advisors to read it. It took a few months and numerous phone calls and emails to get him to actually read it, but as some of you may know, I'm very well known for my persistence. And when he and his advisor finally read the report, they told me it shocked them. I had to really, process this because I realised that when a politician visits an aged care home, the manager puts on a lovely afternoon tea, employs extra staff, and introduces them only to the happy residents and families. Soon after Ken read my report, I received a phone call asking whether I could do similar research for home care. Ken recognised that I am truly independent. Unlike the agencies that we know about, COTA and National Seniors, etc., I do not receive any money or any government money. My aged care advocacy is all voluntary. So I can speak with frank and fearlessly. I don't need to worry about where the next check's coming from. Ken told me he wanted to know older people's experiences of in-home care, from those who receive home care packages and also the Commonwealth Home Support Program. I'm not going to speak much about this, but I do wish the Mornington Peninsula Shire Council had read this report before they made their decision to transition council's home care to private providers. My consumer research, they call old people consumers, but anyway, my consumer research on residential and home care should contribute to evidence-based policy. However, there are some important barriers. Aged care policy is primarily determined by providers of aged care, bureaucrats and politicians, not older people, families and staff. Before I start talking about my solutions or my suggested solutions, it's important to talk briefly about the Royal Commission. Scott Morrison's announcement of the Royal Commission into aged care surprised everyone, including the Aged Care Minister, Ken Wyatt, who only the week earlier had told me we don't need a Royal Commission. He said, we have all the evidence we need. And I responded, we just need the political will to act. The announcement of the Royal Commission came on the eve of the ABC Four Corners special investigation into the failings in aged care, which I contributed to. But when the Royal Commission was announced, I argued in The Guardian that government by media had replaced careful consideration of the evidence. I believe the Royal Commission into aged care, like the Royal Commission into banking, was a strategy for the previous government to continue to kick the can down the road. Before jumping into yet another expensive Royal Commission, it would have been prudent for the government, or the previous government, to review the numerous inquiries that both the Liberal National Party and the ALP governments had initiated over the past 2 decades. Surely the government didn't need Four Corners to inform them that the aged care sector is in crisis. There have been so many inquiries, reviews, consultations, think tanks and task forces that have provided mounds of evidence of inadequate personal care, negligence, neglect, abuse and assault. These inquiries have resulted in a large number of really good recommendations, most of which have been ignored by successive governments. I predicted the findings of the Royal Commission would be similarly ignored, and I have been proved correct, though my fingers are crossed with our new federal government. Ken Wyatt invited me to assist with the terms of reference of the Royal Commission, but in the end, the major failing of the Royal Commission was the 2 Royal Commissioners disagreed. People think I'm joking when I say Lynelle Briggs and Tony Pagoni should have had counselling to sort out their differences before making their recommendations. Their disagreements resulted in the Royal Commission's recommendations being a total dog's breakfast. When Anika Wells, who's the new ALP Aged Care Minister, said the ALP would accept all the recommendations from the Royal Commission, I contacted her to ask which recommendations, Lynelle Briggs's or Tony Pagoni's. It has become increasingly clear that the providers want Lynelle Briggs's recommendation, and that means that the Department of Health and Anika Wells are supporting Lynelle Briggs's recommendations. I argue that her recommendations tinker with the aged care system. Tony Pagoni's recommendations would have genuinely reformed the aged care system. Not surprisingly, I supported Tony Pagoni. Tinkering with the aged care system will not fix it. We need an aged care system that positions older people, not providers, front and centre. We desperately need a new aged care system that is focused on the human rights of older Australians, not the profits of providers. Now, I've made a list of 15 suggestions for reforming the aged care system, And I'm going to spend the remainder of this talk speaking briefly to each of these suggestions. Not surprisingly, my first suggestion, and probably the most important suggestion, is we need a new Aged Care Act that focuses on the human rights of older people. The primary cause of the systemic failures in the aged care system is John Howard's 1997 Aged Care Act. I'm not the only person to say that, although I've published about that quite a bit. Others have said it as well. I mean, this Aged Care Act puts providers in the driver's seat, not older people. One of the most common complaints heard during the Royal Commission is aged care homes do not employ enough staff. I mean, and there's a reason for this. The current Aged Care Act states, and I'm going to quote it, that providers are required to employ adequate numbers of appropriately skilled and trained staff. Now, this lack of clarity enables providers to determine what is an adequate number and what is appropriately skilled. As a result, private providers have replaced registered nurses with much less skilled staff. And given staff salaries are the main outgoings for aged care providers, many providers minimise staff numbers. Guess why? So they can maximise profits. Thank goodness, a new Aged Care Act is something both commissioners agreed on. So it was music to my ears when the first recommendation of the Royal Commission was a new Aged Care Act to come in no later than July 2023. They also stipulated in the second recommendation that this new Aged Care Act should focus on the human rights of older people. I mean, all I can say is yay. My second suggestion is also not, they're all obvious, my suggestions, but we need effective regulation. You'd think that was just obvious given that we're caring for older people, but in 2017, which is like 5 years ago, the government released the Aged Care Roadmap, and you can get it online if you'd like to. This Aged Care Roadmap promotes lighter regulation, so less regulation, and a consumer-driven, market-based system. Now, the reason for this is it's intended to increase competition within the aged care sector. Paradoxically, the providers of aged care services lobby simultaneously for a decrease in regulation and an increase in government subsidies, of course. Providers genuinely believe the government should step back and let the free market operate. But these so-called consumers are often frail, elderly people, some with dementia. How can an elderly person with dementia drive the aged care system in a free market? Furthermore, when the taxpayer is subsidising the care of elderly people, the public's investment needs to be protected in the form of more regulation, not less. In my opinion, our new federal government should ditch the Aged Care Roadmap that has driven aged care down the neoliberal road and over the cliff. The aged care sector desperately needs a regulator with teeth that ensures providers are accountable. So my next suggestion revolves around transparency and accountability. My research on residential aged care and in-home care indicates the public wants more transparency in aged care sector. Although many people, myself included, believe the care of older people is too important to be left to the free market, our local council clearly supports a consumer-driven and market-based system, as evidenced by their decision to transfer local council aged care services to 2 large private providers. It was also evident when the Mayor justified this decision on ABC Radio with Virginia Trioli. In a free market, the so-called aged care consumers require access to information to inform their choice of product. For example, to make an informed decision when choosing an aged care home, aged care consumers require information about the home's standard of care. However, aged care homes are not required to disclose information about their standards of care. How can people make informed decisions when they do not have access to this vital piece of information? Please don't faint with this next sentence, but the most common reason providers give for not sharing this type of information with the public is commercial in confidence. After lobbying from advocates such as myself, a crossbencher, Rex Patrick, tabled 3 critical amendments to the Aged Care Legislation Amendment Bill in 2019. If these amendments had been passed, they would have been a complete game changer. They would have improved transparency and accountability around finances, staffing ratios, and complaints in an aged care home. However, they did not pass, thanks to the Liberal National Party and Pauline Hanson. Without financial transparency, the public has no way of knowing how providers spend the government subsidy, which is now a whopping $21 billion each year. Do they spend the subsidy on providing nursing care, meals and activities for residents, or on salaries or sports cars for their executive team? The peak bodies representing providers say they welcome transparency, yet they lobbied against financial transparency by producing a red tape report. This report claimed that sharing financial data with the public leads to excessive costs. This claim is total nonsense, given the providers are required to share financial data with the Department of Health. They just don't want us to know. Anyway, so my next suggestion is also an obvious one. We need to increase staffing levels and skill mix. A key to high quality aged care is a good staff-resident ratio. Without mandated ratios, many aged care homes operate with far too less registered nurses and personal care attendants. My research found that aged care homes with high numbers of well-trained, empathetic staff, like in my mother's aged care home, invariably provide high-quality care. The physical environment matters much less than the personal care. The personal care is the number one thing that people want. Residents' wellbeing depends on staff having time to deliver genuine person-centred care, irrespective of whether there is a chandelier in the lounge room. Which brings me to the 180 or so Victorian state-operated aged care homes. In 2015, the Andrews government introduced nursing staff ratios to public hospitals and public aged care homes. Although these state-operated homes are often in older buildings, they are really well staffed. During the past 2 years of the pandemic, most residents who died from COVID were in private aged care homes, not state-operated aged care homes, highlighting the importance of high numbers of well-trained staff. I am a huge fan of these Victorian aged care homes and fully support Kate Lardner's advocacy for a state-operated aged care home to be built in Mornington.
Recording in progress.
Something just happened. Okay. Not just improving staff numbers, but we actually have to also improve their training. Caring for older people with complex health issues is a demanding job that requires specific expertise. TAFE offers reputable 12-month courses. However, there are also fast-track courses, some as short as 6 weeks. These short courses do not equip graduates to work competently with older people. My next suggestion is the registration of personal care attendants. Now, as many of you would know, there is oversight of most healthcare professionals. Registered enrolled nurses, psychologists, social workers, etc. must all be registered with respective professional bodies. But personal care attendants are not registered with any professional body. To work in an aged care home or in a home care, personal care attendants, support workers, require only a police check. Currently, when a personal care attendants are sacked for poor standards of care or some other issue, they simply get another job in a different aged care home or with a different home care provider. I witnessed this in Mum's aged care home when standards of care declined after a new manager started. Standards of care in an aged care home often depend on the manager, and when this new manager came in, standards of care dropped. But there was also complaints about 2 personal care attendants who were allegedly robbing residents. People with dementia get robbed all the time because people say they don't remember. But there was also allegations that they were abusing residents and they were accused of negligence. It was a difficult situation because we didn't know what to do. So we called a meeting of residents' families and we all shared our complaints. Now, this process was really important because when you share complaints, before that, everyone thinks their problem is just their own problem, a one-off. But the meeting we had highlighted the fact that there was a serious problem in this aged care home since this new manager had started. So what did we do? Some people wanted to go straight to the media, but I did not see how this would resolve our problem. I suggested in the first instance, families documented their grievances. Remember, I'm a researcher. So I then wrote a 60-page report, which I gave to the owner. And the first thing he did was to apologise. And I could tell it was a genuine apology. To his credit, he responded quickly. The manager was retired, or a euphemism for sacked, and the 2 personal care attendants did not work in the aged care home again. But my concern is they went to work in another aged care home, which they did. So I'm really glad that one of the recommendations of the Royal Commissioners is to introduce a system of registration for personal care attendants. So it'll be similar to other healthcare professionals. I advocated for this recommendation to be introduced immediately. However, the previous government did nothing. Thankfully, our new federal government has promised that personal care attendants will be registered. We now need the slow wheels of bureaucracy to move. The next couple of recommendations aren't commonly talked about, but they're really important, and that is disclosing performance indicators. I've tried for 6 years to get data on adverse incidents in aged care homes, such as the incidence of pressure injuries, dehydration, malnutrition, medication errors and falls. This information is needed not only for researchers such as myself to have an evidence-based discussion about standards of care, but they're also important to help people make informed decisions when choosing an aged care home. Let's say a family is looking for an aged care home. After reading several glossy brochures, they choose one. 6 months later, their loved one receives the wrong medication and is rushed to hospital. They then find out that there have been several medications in that aged care home over the past year. If they had had that information before they chose the aged care home, they would most likely not have chosen it. In a similar vein, I have argued till I'm blue in the face that the public could have access to all the regulators' reports. They do regular reports on aged care homes and home care providers. Now, I once asked Ken Wyatt to give us, why can't we have this information? So he took my idea to the Aged Care Sector Committee, and Channel 9 did a Freedom of Information and found the minutes from this meeting and just really blew my head off that the idea was voted against because the CEO of COTA, which is allegedly a consumer organisation, claimed patronisingly that the information in these reports from the regulator would be too technical for the public. What do I say? But it's not just the reports the regulator does on the aged care homes and the home care providers. We also need access to the complaints that are made. We also need to know how these complaints are managed because reporting of complaints is part of my push for transparency. Although complaints are inevitable, it is important to know how these complaints are resolved. Unfortunately, once again, the Aged Care Quality and Safety Commission simply refuses to share this information. And the question I have been asking for 6 years is, who decided that information on the safety and well-being of residents and recipients of home care must be kept top secret? I think I have time to give a quick example of this. It happened during the pandemic. During the second lockdown, the government historically has been far more concerned about protecting aged care providers. Some of these aged care providers are multinationals and large superannuation funds. They're much more interested in protecting them than the interests of those living in residential aged care and receiving home care. And the best example and most recent example of this was during our second lockdown in Victoria. Richard Colbeck, who was then the Minister for Aged Care, said he would not publicly name the aged care homes with outbreaks of COVID. This was during the beginning of that lockdown. He said he was worried about providers' reputational damage. So what did I do? Yes, I'm a pain in the neck to these poor old governments and bureaucrats, but I asked my Aged Care Matters Facebook group to name these aged care homes with outbreaks. I then published the list of 124 aged care homes. And it's the only time in my history of being a tweeter that a tweet of mine has gone viral. And soon after this, the Department of Health published the names, as they should, in a weekly report, and they continue to do so. I've got about a few more minutes to go, but I'm just going to talk about banning the use of antipsychotic drugs. These should not be used unless they're prescribed by a psychiatrist. Alarm bells should have gone up when we had the first national audit of psychiatric medicine in aged care homes. They found two-thirds of all residents were prescribed psychotropic agents regularly. This is chemical restraint. And it's not a new problem. Like everything in aged care, nothing seems to be new. In the past 20 years, there have been several government inquiries, surprise, surprise, into the over-reliance on medication to manage the behaviour of residents. These inquiries all recommend educating staff to adopt alternative ways of managing behavioural problems. Don't just bomb them out with medication. Learn strategies, distraction, all sorts of things can be used. But the elephant in the room that we don't talk about enough is the doctors who prescribe this medication. They're often prescribed by a GP. There is strong evidence that many psychiatric drugs are not only ineffective, but they may cause older people substantial harm, including falls, pneumonia, and sometimes premature death. So why are doctors prescribing these drugs? That's a rhetorical question, because we know why they're being prescribed. They're being prescribed because there is not enough suitably trained staff employed to manage residents or to work with residents, distract them, do activities. There are lots of ways to, rather than just giving them a medicine that makes them drowsy in front of the television. I've also argued for a long time, probably 10 years, for the mandatory reporting of elder abuse. Now, my beginning advocacy was a personal experience with financial elder abuse, and I found out that it is the most common form of elder abuse. Research has identified adult children, particularly sons, it's another gendered activity, that they're the most common perpetrators of financial abuse, and the victims are most often women over the age of 80. So back 10 years ago, I worked very hard to ensure red flags for financial elder abuse. So nowadays, a bank is required to report when a financial power of attorney makes a large withdrawal from an older person's account. I didn't realise 10 years ago, but it is certainly worth thinking about, most research in elder abuse has been undertaken in the community, not aged care homes. So in more recent years, my attention has turned towards elder abuse in aged care homes, where the most common form of abuse is not financial, it's actually physical and sexual. So I lobbied for a serious incident response scheme, which we now have, though their reporting, like everything else from the Aged Care Quality and Safety Commission, their reporting has been hopeless. The last few recommendations are about home care, and I've got 5 minutes to talk about home care, but we know that most older people want to stay at home as they age. In the old days, before My Aged Care, Victoria had one of the best home care systems via home and community care. Local councils employed highly trained, caring and competent staff to provide an invaluable service to older people in our community. In 2013, the Gillard ALP government introduced the Living Longer, Living Better aged care reforms. These reforms were motivated by forecasts of a burgeoning ageing population and concerns, and these were quite legitimate concerns, about how the government could afford to provide services for older people in years to come. These bipartisan reforms encouraged private home care aged care providers to enter what the government bureaucrats call the aged care marketplace. Soon after these reforms were legislated, the Liberal and National Party won the federal election, and they have forged ahead with gusto to implement the neoliberal reforms. The coalition government was determined to turn the provision of home care services into a competitive market, turning older people into economic participants. Some councils have rejected transitioning their long-standing and long-trusted services to market-based systems. These councils appreciated how important their services are to older people in their communities. My research shows that council aged care workers are valued and sometimes loved by their clients. Older residents and their families appreciate having a highly trained and fairly remunerated council employee provide aged care services. They can also be assured they are not being ripped off by a private provider that prioritises profits over care. The most common complaint about corporate home care providers is the high turnover of unqualified, inexperienced, untrained and poorly paid support workers. A high turnover of staff is a recipe for disaster. It results in strangers being sent to work in older people's homes, and older people simply have to trust that they will be treated with respect and kindness. The Health Department has been talking about combining home care packages and the Commonwealth Home Support Program since 2018. The new program, to be called the Home Support Program, was due to start next year. However, the Albanese government has delayed the start until 2024. In announcing the delay, Anika Wells, the Aged Care Minister, said the government was, I'm quoting, taking the time to address the concerns instead of rushing to failure. As a result, several councils have delayed their decisions about whether to remain a home care provider. The best way to ensure older people get the residential and home care services they deserve is for governments to work with older people and families when designing aged care services. The new buzzword is co-design. However, like many bureaucratic buzzwords, the word has been adopted, but not the practice. I've attended several co-design workshops with KPMG that have been tokenistic consultations. Again, let's hope the new Labor government does it better. My final suggestion, which I'll say very quickly, is actually relates to the pandemic, when many aged care providers detained residents in aged care homes. The past 2 years of COVID has been a heartbreaking time for many residents in aged care homes and their families. When the pandemic took off in March 2020, all non-essential staff were banned from entering aged care homes. This included family members who regularly cared for their loved ones by helping with feeding, toileting, social support and so on. I would have been banned from going to visit my mother, for example. Providers claimed a total lockdown was necessary to save lives. However, families who contacted me, hundreds of families who were locked out, they were far more afraid that their loved one would die of neglect, not COVID. So just as a final sentence or two, if the current Labor government genuinely wants to reform the aged care system, the Minister for Aged Care needs to engage with recipients of aged care services, both residential and home care, with families and with staff. Many years ago, I gave similar advice to the Department of Health. So they organised a consumer round table with Ken Wyatt when he was the Minister for Aged Care. I was invited, together with many CEOs of consumer organisations. After the introductions, I realised there was not one genuine consumer at the table. So I said to Ken Wyatt, publicly to all of them, who was also the Minister for Indigenous Affairs, can you imagine convening a meeting to discuss Indigenous affairs without one First Nations person at the table? Unlike many of the CEOs, Ken understood my message. So my message to the federal government and the department, which is now called the Department of Health and Aged Care, thanks to Linnell Briggs tinkering. So my suggestion is to quote Einstein, we cannot solve our problems with the same thinking we used when we created them. Thank you.
Thank you very much, Sarah. There is one question in the chat from RI. Do you want to actually ask your question or do you want me to read it?
Can you just read it, please, Erica? Because I've got another question I've got.
Okay. I didn't realise, didn't work out who RI was. Just let me get so I can actually see the whole... so I can see the whole lot of it. Pop out. Okay. So Rosemary says, I thought almost all residential aged care in Vic were privately run. Yep. Please clarify what state RACs are covered by state government ratios.
Yep.
And also a comment, social workers do not require registration with a professional body.
I didn't know that. I thought they did.
Yeah.
My mistake. Psychologists do. Certainly registered nurses and enrolled nurses do. I thought social workers did too. I'm sorry about that. Look, most people don't know about these Victorian run aged care homes. In fact, people think they're mainly in rural areas, and I guess about 2/3 of them are. Some of them are in Melbourne. I can think of 3 in Melbourne. We don't have any on the peninsula that I know of. Now, these aged care homes, were often attached to the local hospital or and because I don't know if it was actually intended at the time, but when the Safe Patient Care Act came in 2015, it was just included with, aged care was just included with the public hospital. I mean, the ANMF and other unions have been advocating for increased ratios in public hospitals. And they achieved that. But when they achieved it, aged care homes got ratios. But as I said, people don't know where they... So what's the question? The question is, please clarify what state. Well, what state? I don't know what you mean by what state. In Victoria...
Sorry, I'll interrupt.
Thank
to
you.
Clarify my question a bit, if that's okay.
Yes, please.
I just, as I said, I had worked on the assumption, because my experience has been that all the aged care facilities I looked at with my parents were privately run.
Yep.
So I was surprised when you talked about state-funded or whatever nursing homes, which have the same ratios as public hospitals. And I'm just wondering where are they?
They aren't. I'd be happy if you put your email address in the chat. I can send you the list of them all if you'd like me to. As I said, they're not well known, but one question I asked a journalist to ask during one of those, Dan's press conferences during COVID, was how many, this was about, towards the end of the second lockdown, how many Victorian-operated aged care homes have had an outbreak of COVID? 0. None. Because they're trained in infection control. They knew what to do and they did it. Families were not locked out, as far as I'm aware. So they are really well run. Look, I think there's close to 800 aged care homes in Victoria, and there's 180 of those are Victorian operated. So the majority are private. And when I say private, I mean for-profit and not-for-profit. They're all considered private. So the majority are definitely private.
So you were saying there's none on the peninsula, which are Victorian ones.
No.
And most of them are in country Victoria, is that correct?
Correct.
So that's probably why we weren't aware of them.
Yeah.
Okay.
And Kate, I get Kate's flyers in my letterbox, and when I saw that, I thought that's such a good thing to advocate for an actual, state-based, state-operated aged care home on the peninsula. I mean, maybe attached to Rosebud Hospital would be fantastic. Yep. Although that's not Mornington, is it? Anyway, I'm now thinking that's a good federal policy. But anyway, yeah.
Well, it's Mornington Peninsula.
Yeah, but it's for the Mornington electorate. Anyway, but it's still a great policy, Kate.
Thank you. Sorry, I've got making sound in the background. But yeah, all of the aged care facilities down here are private.
Yep.
And I think and also with the Ryman aged care facility, it's going to be people that come from all around who can afford to live by the sea for their aged care facility. It won't be for local residents. And that's what a public facility allows us, is accessibility for our local residents. And like Sarah was saying, it has the ratios. It's just we need to have choice that we don't have down here.
Yeah. Sarah, are the non-profits better than the for-profits, or doesn't it make a difference?
Well, in fact, sometimes the not-for-profits are worse than the private. Like my mum was in a for-profit aged care home. And I have to say, I mean, luckily, to be honest and things, my parents had money, so they could afford to go into this home. And it was, it was very well run. I get a lot of complaints about the not-for-profit aged care homes. And the other thing is, and this is real, it was actually a CEO of one of the stock market listed aged care homes, Estia, that said to me, we have to be absolutely explicit about how we spend every cent of the government's money, because they have to do those reports for the stock exchange. We don't know how many. These not-for-profit, particularly the faith-based ones, they don't have to report hardly anything, and we have no idea where the government subsidy is going. We saw this with St Basil's, which was a Greek Orthodox aged care home. You might remember it was the one where many people died during COVID. We found out that they were paying an exorbitant rent. So a lot of the government subsidy was going into this exorbitant rent that was going to the Greek Orthodox Church, which Background Briefing did a wonderful show on that, exposing some of that. So in answer to your question, not necessarily, absolutely not necessarily. I know we hear a lot about the bad aged care homes, but there are some private providers who go into aged care, both residential and home care, because they genuinely care about older people and they want to make, let's face it, that's a person's last stage of their life is when they go into an aged care home. And they want to make that last stage of their life as good as possible. And many people do go into aged care for the right reasons. However, because it's government money, we saw this with Pink Bats, we've seen this with vocational education. Because it's government money, there are also some unscrupulous operators. We heard about Epping Gardens, we heard about those chicken farmers who got into the aged care sector. That's something else, I'm sorry, I didn't mention, but in 1997, John Howard took away the probity requirement. So basically, an owner of an aged care home could be someone like that chicken farmer who had gone to jail for mistreating chickens and then came out of jail and bought into aged care. Forgotten my train of thought now, but yes.
This is a question from Georgia and Thalia. They've got their hands up. Just remember to unmute yourself.
Me?
Oh, yes.
Oh.
Thank you, Sarah. That was fantastic. I'd just like to say that people needing aged care often do not have a choice, and the families have to find somewhere that will accept it has a place. So it's not really that simple, for people that have had a fractured hip in hospital then need to go to aged care, and it's what's available. So people, whether it's public or state run or private, they still have not necessarily got a choice, and that's the.
And I'd love to respond to that. To everyone who's here, who's got elderly parents, start the conversation now. It's a really hard conversation to start, but we started it with, I have 2 doctor brothers and I'm a nurse, and we started the conversation with mum and dad when they were looking. They could have got home care maybe to manage, but we really started the conversation about aged care, and they went into aged care. They chose it themselves, which is quite unusual. Most people, as I said in my talk, they do it after a health crisis. And they get a social worker helps them find an aged care home. But the other, just in response to your question, so firstly, please start the conversation early. But secondly, because of the Royal Commission and because of COVID and all the things we've seen in the aged care sector, which were all predicted, I've written a piece at the beginning of COVID that predicted all these problems that have happened with COVID, because of the systematic problems, there are lots of vacancies now in aged care homes. Many of them are not full because families do not want their families to go into an institution where there could be another lockdown, there could be, we've heard all these horror stories. So there are vacancies at the moment, but most people...
You may not get the one... I'm speaking from personal experience.
Yeah.
Also, I have been a physio working in aged care. I'm not now, but for 12 years, so I know, firsthand a lot of the issues. And one is, from the physio point of view, one of the places, it's now Back Care in Frankston on the Murdoch Road. They employed me because they're required to have a physio, and that amounted to 8 minutes per resident per week.
Oh, my goodness.
I left that place because I've left 2 aged care places because they wanted me to make an assessment, write a treatment program, which I knew wasn't going to be able to be fulfilled because of the staffing inexpertise and limits, and not to have any input into what physio the residents had. And I felt that was entirely unethical, that they were then going to say, we've got the physio program, but it was one that wasn't going to be overseen by me. So that's another part of the aged care. I wish now that I'd put something into the Royal Commission about the need for having physiotherapy for aged care, because that improves, anyway.
Well, let me just say, Georgie, there's a new funding model that came in, right, about a month ago, which is basically the previous federal government, or the health department. As you might have heard, got the sense from my talk, the health department is where most of these systemic problems are. And they're the same people now advising the current government. But the new funding model has taken out physio completely.
Oh, really?
It's a complete oversight. The person who designed the new funding model, Kathy Eager, Professor Kathy Eager is the new person. She had physios included in the funding model and activities people and all this stuff that, people need in an aged care home. It's not just clinical care you need in an aged care home. You need so much more. Anyway, the new funding model, because it's only been half implemented, not the whole thing, has taken out physio. So many providers will not be giving their residents physio. So it's terrible. So I can send you more information on that, Georgie, if you like, but terrible.
Yeah, that's terrible. I didn't know. No.
Thank you. Thanks, Georgie. Julie, I think you were the next with your hand up.
Thank you, Sarah. That was absolutely magnificent.
I don't cope well with compliments, so move on.
Amazing.
Yeah.
There's heaps in the chat.
Okay, so my question is this. If physio is out of the funding for residential aged care, is it also been removed from the home care package?
No, it's not. No, it's not. The problem with home care packages, anyone who's read my stuff on home care, is the private providers. Like if I go and get a physio appointment now for something, I'm 60, so I might need it for just mobility, who knows. I pay a certain rate. Let's just say $100 an hour for my physio. I don't know how much physios cost. But if you're on a home care package, the provider might charge you $200 for the same service. So you see, so the problem with physios and exercise physiologists and all these different things is they get the high fee, and they take so much out of the home care package that I think is I call them unscrupulous operators.
Thank you, Sarah. And I just wanted to ask, is that very similar to the conversation that's being had at the moment about rorting of the NDIS?
It's very similar, very similar.
Yeah.
Very similar. In fact,
thank you.
I spoke on ABC Radio on Friday about the Labor government has brought in capping the case management fees and the admin fees in home care packages. But the scrupulous operators will be absolutely fine with that, but the unscrupulous ones will just put the extra fees into other things.
Yeah.
Yeah. I mean, they pay their support workers a good pay would be $25 an hour, and that's a good pay. And they charge the actual person $60, $70 an hour.
Okay. Yeah. Thank you.
So I think the order of hands is Maureen, Rosemary and Marilyn. I'm sorry, speak up if I've missed anybody. So Maureen next.
Barbara wants
Marilyn,
to
did you want to go next? It looked like it might be linked to mine's a slightly different topic.
Oh, well, I just wanted to ask what can be done to solve Mornington's home care package, because I have a friend with motor neurone who gets no help.
Oh, look, well, I mean, I'm very happy to say this, and I don't know if anyone here is from the council, but I have contacted the previous mayor, Anthony Marsh, I would say 20 times. I'm just trying to talk with him because there are solutions, but I haven't spoken to him. I mean, I haven't. There was just so you know. I mean, because I don't do this for money. Okay, I do this because I really think there's a real gap in a fearless and frank critique of the sector. So this woman from Western Australia has a 90-year-old mother in Mornington who hasn't had home care since May, right? Now, she's talking to her daughter. I'm going to have to vacuum the house myself, she said to her daughter a while ago. And her daughter's really worried that if she pulls the vacuum out, she'll fall over because she's, hasn't vacuumed her own house for a while because she's had the council come in every 2 weeks to clean her house. So I said, I will go over and clean her house. If the councils aren't doing it and the new provider's sending out these letters to say, sorry, we can't do it yet, we're not able to do it because we haven't got enough staff. I thought, I wasn't going to talk too much about this, but I thought the most shocking thing that Anthony Marsh said on Virginia Trioli's interview, which I've got on my YouTube channel, I put it up there, because I thought he said they knew that they didn't have the staff. This is a nationwide problem post-pandemic. We don't have enough staff. So why not delay the transition until they do have enough staff? I mean, Yarra Council read my opinion piece in The Age and they immediately delayed their transition. They're also going to transition, but they're going to wait and see what the Labor government offers with their review. That was a sensible approach. That's what I wanted them to do. That's all I was trying to get him to do, is delay it. But anyway, too late. I got involved too late.
Would you mind? Sorry, Maureen, I know you were next, but can I jump in with this one? Because my issue was directly related to this. I just really want, I don't know if everyone's aware that the two providers that have come in since the council has stepped back are Mequicare and Bolton Clark. And they are both like not-for-profit organisations, but it all goes back to the government reforms that Sarah was talking about, where they've both been placed in a position where they've got to be, part of a marketplace, and they're just not prepared. Just to give you one example, they're not getting staff because all that they are able to offer is over $8 less an hour than what the council were paying, and therefore a lot of the council they had hoped, because they had hardly any time to prepare for this, what they had hoped is that they would be able to get many of the council workers coming across to them. But of course, they're not going to accept having, $8 to $10 less an hour for doing the same job, probably under worse conditions as well. The only comment I was going to just make everyone aware, because it's absolutely horrifying, is that both Mequicare and Bolton Clark have currently closed their books to any new referrals that are needing to be made for an elderly person needing home help or personal care in their home. And the ones who are on the waiting list are either not receiving any service yet or getting an absolute minimum. So, like previously they might have been getting, say, home help once a fortnight. Now it's reduced to 1 hour a month. So can you imagine what can be done to assist an older person in their home for 1 hour in a month? The whole situation is absolutely, it's horrendous. And just for your information, Sarah, I'm actually a social worker for one of those organisations, and trying to put fires out and trying to support people is just a nightmare within the aged care system at the moment.
Thank you for that. I agree with everything you've said. Interestingly, when I was a candidate, I don't think this is not portraying anything, I got contacted by someone in Mequicare, actually, to have a coffee with me. And wow. So wow. All I can say is wow. And it also should be stated, just to let the council off the hook a little bit, the federal government chose Mequicare and Bolton Clark. Bolton Clark actually used to be the Royal District Nursing Service. It was taken over by Bolton Clark. Now, you've got to wonder, if you go up to the halls of Parliament House, you'll see lobbyists from the private providers, and Mequicare and Bolton Clark are up there lobbying. Don't you worry about that. So you've got to ask some of these questions. I don't like being cynical. I really don't. It's not my nature to be cynical. But I have become so cynical about aged care.
On every fucking level.
Yeah. Oh, I heard that. I like that. Normally it's me who says that, but yeah, okay.
I think Maureen's next, probably.
Oh, actually, yeah, it was exactly that same topic. I was wanting to ask Sarah to comment on the Mornington Shire Council's outsourcing of home care services. And yeah, I just recently phoned or telephoned the local member on behalf of my neighbour, who hadn't had home care for 6 months and was actually having to take painkillers in order to do her housework.
Yeah.
So, it's just, my understanding, Sarah, was that the council had another year.
Oh, they do. I mean, so yes. And as I said in my talk, I mean, some councils knew that. Some councils, as I said, read my opinion piece in The Age, which told them that, and have delayed their decision. Look, it was a busy time. I didn't know. I haven't lived here permanently. I've lived here permanently for 3 years now. This discussion, apparently, all the consultation, I have been told, with the community happened in 2018. I don't know if any of you remember that, but apparently you were widely consulted. Everybody knew this was happening. It was a wonderful consultation. We all agreed this was... But I don't know. From my email box and from my phone calls, I think it took a lot of people by surprise, particularly at this time when we all know, and Anthony, as I said, acknowledge this on the radio, we all know nationwide, because of COVID, there is a reduction in staff in many of these private. Not surprisingly, Bolton Clark and Mequicare have closed their books because they just don't have the staff. So it was the absolutely worst time to do this. I'm not saying, I'm hoping that with all this advocacy and all these pieces I've written and stuff, Anika is going to say, hang on, we need to think about this. Because Darebin Council, unlike Mornington, I'm sorry to say this, but where I used to live in Northcote, this was happening in Northcote in 2019. And we lobbied the council so hard with petitions and we went to meetings. They agreed to talk with me. We sat down. They are now home care providers for packages as well as... They stepped up, not stepped down, because their community demonstrated that they valued council services. The council staff, they valued them. But the truth be known, it does require extra money, as in Darebin was putting in an extra $6 million every year. Now, I don't know, but if we surveyed everyone on the peninsula, or would you be prepared for $6 million of your rates to go into aged care? My feeling, given the demography of the peninsula, most people would say yes. We'd rather have that than you spend $6 million putting a groin into Mount Martha North Beach or something. We'd rather you spend it on aged care. So I think they've made the wrong decision. I've made that perfectly clear in the local paper. I've stepped back because I don't want to be hounding them. I've tried to talk with them. I've tried to have meetings. I've tried to offer my help. But unlike Darebin, it's all been rejected. So, why don't I agree?
So Sarah, the other bit of my question was about the funding. I don't know if you can get your head around it, but to me, if I've paid my rates, all this time, and if we've all paid our rates, and that would have gone to subsidising home care services. Like, is this too simplistic?
No.
What's happening to that money now?
Look, you'd have to ask the council directly about that. But I don't know how much Mornington Shire put into aged care. But Sorry?
It's $4 into aged care and disability services per $1,000 of rates collected.
Okay.
It's over $600 per 1,000 collected, goes into maintaining the council's existence.
Okay, so my question...
Sorry, can I just say that my understanding was that was the main reason for the decision for council.
Financial?
Financial, okay. Because they were already subsidising their aged care services by such a significant millions previously that and that there were certain ratepayers who really objected to...
Okay, so that's interesting. Okay, so I didn't know that, but I think it'd be interesting to know, and it would require, genuine consultation or general, because, when we surveyed, and this is what I said to one of the councillors who was talking to me, when we surveyed the whole population around a levy, like a Medicare levy, but an aged care levy, 85% of Australians support a levy. So 85% of Australians actually want good aged care services. And I suspect it would be 85% Mornington Peninsula is the second oldest electorate in Australia, I think. Well, Flinders is. I'm not sure, but it's got an ageing population. So I suspect our figure would be even higher because, we're a civilised country and we want older people to be treated well. As I said at the very beginning, I think the thing that needs to shift is our ageist attitudes. We are living in an ageist society, and that is evident when a journalist rings me and says, "Can you speak about residential aged care?" And I say, "No, speak to a resident about residential aged care." So I put them in charge. You've been hearing a lot more from residents and recipients of home care packages because I say speak to them. They're not all unable to speak for themselves. So we need to respect older people more, and that's why my acknowledgement of country included the way First Nations peoples respect their elders. And, just why... Okay, we're not economic units anymore because many of us aren't working anymore, but, I want age. That's why I do this, because I do want older people to be treated better. So, anyway.
Denise, do you have more to say?
It's actually Barb.
Barb, yes.
To make
Barb Remington?
Yeah, as you might be aware, I've had several letters published in the local paper about in-home lack of support. There seems to be a deliberate policy now on behalf of the Shire to not comment, to not provide any accountability, to not provide any numbers. We know that there were 4,000 people who were turfed off the in-home support. We have no idea how many of those people still have not had any service.
There's lots. Yeah.
Is there any way we can force them to answer any of our questions?
I've had no luck, so I don't know. Anyone else having luck? I'm not. I didn't want this talk to focus on Mornington, because although transparency is my thing, I just think, why can't we be more transparent? So I have tried to get my hand on the report that the council staff gave to the councillors, because clearly that report influenced the vote to get out of aged care. I can't get my hands on it. So if anyone can get their hands on it, please email it to me, because if there's a council person here today, that report should be on their website, because it's just, anyway, we want to know why that decision was made. And we don't want people to just justify. If you've made the wrong decision, own it. Anyway, I'll stop. I didn't want today to be just about them, because clearly the councillors have been advised about this. The report might be very strong. I don't know. Apparently they've consulted. In their minds, they've consulted. So, I don't know.
Okay, I might ask Diane to do the vote of thanks, and then we can have a look at the sort of advocacy that might be useful from Swan. So hand over to Diane. Thank you.
Okay, well, I'm a bit overwhelmed and feeling that there's nothing I can say, Sarah, that will really summarise your inspiring presentation today. And I think you've touched on something that's really close to all of our hearts. And I think it's something that maybe I'm speaking out of turn, but the implications I'm getting, or the information I'm getting from all the people that have been speaking here today asking questions, is that we would welcome some opportunity to support you in your advocacy efforts, because you're the person who is knowledgeable about the big picture. And I know you didn't want to focus on Mornington Peninsula Shire Council, but I think that's something that we truly want to actually try and do something about. And if we can support you in some particular way to actually have those meetings that you need to have with council or with other government personnel, I think that you'd find that there'd be a big group of people behind you to contribute to that. So thank you so much, Sarah. You've really opened up a whole new avenue for us to take action and to advocate together. I think it's something Swan could do as an organisation, not just as individuals.
Thanks, Diane. I'm just looking at there's a whole heap of things in the chat. But there was one suggestion that could we provide a volunteer team to help the people who are in trouble. I suspect that's perhaps not politically able. Is that true, Sarah, or could we?
We've got to find out who they are.
It's such a tricky one for me, because, one of the things...
I've got several.
I'll just give an example, and I'll use the home. It's a good home. It's called Corora Court, I think, in Mornington, Benetas. I went in to visit my godfather there, before COVID, and everyone I thought was a staff member was in fact a volunteer. And I asked the volunteers, what sort of training? Basically I asked for some help to walk him back to his room, And the way she sat him in the chair, he nearly went on the floor. So I was thinking, what sort of training do these volunteers have? You know, so there's a lot of volunteers. Now, it's you know, people want to, as I said, there's so much goodwill towards older people, but our government doesn't seem to see it as a priority. So I have mixed feelings about volunteers. Should we expect these private providers, some, although they're crying poor, some of them are making a lot of money. Should we expect them to provide staff? Should we expect them to pay their staff properly? Should we expect them to deliver high standards of care? Of course we should. But then, so I'm a bit conflicted about volunteers. I do think it's lovely if volunteers can provide an extra service. Like we had volunteers at Mum's home that came in and did specialist activities that they were good at, you know, like art classes or, you know, lots of things. But they weren't actually doing the care that is required. I don't like the fact that volunteers are doing the care that should be provided by a trained person. Is that clear?
Yes. Yeah.
So in terms of what you guys can do, can I think about that and maybe get back to Erica during the week about what I think? I think advocacy, I think one of the things that I liked about the Royal Commission was it wasn't just Sarah Russell writing for The Age or The Guardian or whoever. Like they could dismiss me as, oh, she's just a, you know, I don't know, whatever the word they wanted to use, probably a swear word. It actually showed hundreds of people having problems with the aged care sector, serious problems with the aged care sector. So the one thing I think Swan might be able to do is collect numbers of people to say, you know, the local council, you've really let us down, or, you know, just some sort of statement with numbers, because it's not just Sarah Russell, oh, here she goes again. It's something with some substance behind it. I hate petitions, but I just think some way of showing it's not just me being... Because I don't know if you remember, but the front page of the local paper had one of the councillors saying it's the activists, and I think they were referring to me and maybe Barb Remington as well, with all the letters, it's the activists who are causing older people on the peninsula to be worried about their home care. And my response was, it's not the activists, it's the fact they're not getting home care that's causing the problem. But so anyway, I think there is something Swan could do with a lot of well-meaning, good, intelligent women could do something quite powerful, probably.
Thank you, Sarah. I suppose one of my questions was whether it should the federal government provide the councils with better funding so that they can fund their own services, or, you know, why does Bolton Clark only pay a much reduced rate? That's some of the thoughts that you might like to address.
I can easily address those things.
Not now necessarily.
Okay, but those things are, I can even direct you to one of my opinion pieces about that, but the council's been getting funding for aged care called block funding from the federal government since the early 80s.
Yeah.
For the HACS, remember HACS, Home and Community Care? Yeah.
But presumably not enough if ratepayers are complaining about all our funding going to aged care.
I don't know, $6 million does not seem a lot of money to me, given the council's budget. But anyway, I don't know.
Julie Petal, you've got your hand up.
I'm just wondering, Sarah, if just with your contrast with the Darebin LGA to the Mornington Peninsula LGA, and talking about the ageing demographic down here, which would, as I agree, would seem to indicate that people would have more interest in it. But I'm wondering if that ratepayer block who were complaining about that, if this is more of a class-based or socioeconomic thing, so that those people are wealthy enough to fund the kind of lifestyle supports that they need, and therefore don't want council money used for people who are less fortunate.
That's such a good point. I hadn't thought of that. But yes, because a lot of people do fund their own aged care.
Yeah.
So that's a very good point. And I can't answer that, but I suspect maybe Swan could survey the whole peninsula. I don't know how much it costs. I think I do know, actually, because we try to give everybody a quick survey about their attitudes towards. But I don't know. I mean, that sort of data would be very interesting, Julie, because if it is the rich people who own beach boxes on North Mount Martha Beach, or some of the rich people, who are saying, no, we don't want council, we want sand on the beach instead, please. I'd be shocked, but yeah, that may be right.
Sarah, could they take up the aged care again if they wanted to, if they decided to?
They said no. I saw both Anthony and, what's his name, the CEO, John? Is that his name?
Yes,
I saw them at the Meet the Candidates. And I did remind Anthony that I'm still waiting for a phone call. And John said there's nothing they can do now. The council, the federal government, he told me, which is, I have to say, what I've been told by the council is different to what Mark Butler, I have a good relationship with Mark Butler, and he contradicts everything the council's saying. So I don't know what the truth is. I mean, I don't know. I mean, the federal government Mark Butler tells me, I've got it in writing, that this was purely a council decision. They were not forced to do this. They chose not to do it. They said, I think that I haven't got the quote in front of me, but it's something along the lines of, Mornington Shire Council decided that aged care was not part of their core business.
Right. Yeah.
There are ways.
Okay. I think we're probably pretty well done with questions. Oh, Georgie?
Yes, I think that I was going to say that thing about the wealthy people. Well, you know, I think most of us would see that Mornington is the aged care, you know, capital of Australia, maybe, with all the very wealthy aged care homes that people can afford. But the thing about volunteering is, I understand, yes, the thing about police checks and everything, but look, why can't we do something to get back to grassroots helping? Like I was thinking, you know, a lot of us could say we could go and clean that woman's home. If we have more networks that are available to help support people in need, it doesn't, everything has, you know, got to be institutionalised almost now, that we can't have these, you know, loose things of a friend helping out. I think somebody put something on that you have to have police checks and everything. Well, I've got that because I've got a working with children's check, so a card. But really, I would love to see a way that communities can get back to helping each other out and to have formal networks that you can hear somebody needs this 90-year-old woman trying to clean a house. Someone can say, hey, can anyone help out?
Yes.
What I'd like to see a bit more of. But thank you, Sarah. You're just absolutely amazing, and it's been a great morning.
Thanks, Celia. So we might move on now. Our donation. Hang on, I'll just mute a few more people.
No, can I say one thing? I've just emailed two people who asked for the public aged care homes. So I've just done that to two people. If anyone else decides after the talk they'd like a copy, just email me. It's easy to find my email. Okay.
Yeah. Thank you, Sarah. The donation, Sarah has asked for it to go to Southern Peninsula Community Support, who do a really great job, including supporting aged people. So thank you for that, Sarah. I think we've talked a fair bit about actions that Swan can take, and hopefully with Sarah's advice we'll come to some of that in the near future. General business, we're thanking Secret Garden, who usually provide our beautiful bouquets for speakers. I'm sorry, Sarah, doing it on Zoom.